The important thing is that we're vaccinating half of the world's children, and that we've introduced 496 new vaccines for a wide range of infectious and epidemic diseases in low and lower middle income countries. About that, the actual fact of this immunization is critical because it's the most cost-effective intervention, and it helps maintain global security and economic stability. And it's really only during this time, I think, that people is really beginning to fully understand the need for vaccines and the importance of infectious diseases. We are going to need to assure that this equal access happens. So we have to make sure that we don't have what happened in 2009, where wealthy countries bought up all of the world's supply. And so although there was a sense that we would have access for developing countries, they didn't get it until way after it was made available to wealthy countries. So that's going to require a strong level of political commitment to do that. You know, what happened was this particular outbreak went first to wealthy countries, didn't get to developing countries. It is now firmly ensconced in developing countries. 67 of the Gavi 73 countries have reported cases. And although the outbreak has not been explosive so far, we don't know if that's because the reporting is bad, the surveillance is bad. It actually hasn't spread that much because of a lack of connectivity, or because with the difference in demographics, perhaps the disease isn't as severe, but we certainly are seeing outbreaks already. Those countries are now about 2% of the world's outbreaks, but our worry, of course, is that's going to shoot up. But the importance is to try to get at least 7.4 billion for the next period, which pays for the core work and strengthening health systems, not for the new vaccines. And as you've already heard, Chancellor Merkel has been a leader. We're very grateful of that. She was the first world leader to come out to support Gavi for this replenishment. We are hoping that Germany will provide some additional finance. We're asking everybody to provide additional finance so that we have adequate finance to be able to deal with this. And so we're in this last six-week pledge. There is going to be an EU pledging conference for COVID that's going to be held on March 4th. For May 4th. This is an opportunity for some of the European donors, particularly, to step in and not only support COVID work, but also the work that's necessary for the routine systems. And we're hoping that we'll see some other pledges that are occurring during that period against our 300 million additional children to prevent 8 million deaths in this next period. And so this was an ambitious target. It's even more so today, but it has to happen. Otherwise, we're going to see these, doubling of outbreaks that is really going to be devastating and to these countries. And if countries were to decide they only do things nationally, it really becomes a problem. And governments have, rightfully so, said we're worried about our countries. That's the job of a government, is to say we're worried about our citizens. But if you want the best outcome for your citizens, you have to think globally here. And that's really the important message. Overall, it'll be helpful that this is a global problem and not a developing country problem alone. But as you know, I've been talking about these outbreaks for a long time. Bill Gates and I did back-to-back talks in 2015. And the problem is at peacetime, nobody thinks about these things. And so the question is, will it be different after this time? Will the world want to invest in strong systems for prevention, strong, resilient health systems for the world, and vaccine manufacturing that is available on call if we need it, as well as drugs, et cetera? That would be a very positive change, because it's evolutionarily certain that we will continue to have outbreaks like this. There also was a statement by the Measles Rubella Initiative suggesting that over 117 million children in 37 countries may miss out on receiving a measles vaccine as part of campaigns in 24 countries. And so these are potentially quite big numbers. There really is an interesting study. Imperial College has done a study where they've asked the question, if you were to stop doing a routine immunization to prevent COVID deaths, For every death you'd prevent in that circumstance from COVID, you would have 128 deaths from vaccine preventable diseases. Because of all the health interventions, vaccines are the most widely distributed. So today, 90% of children in the world get a routine vaccine. The goals for this next replenishment period were to try to chip away at that last 10%. And that's a really important group because 2/3 of that 10.4 million are below the poverty line. And that's the places where if outbreaks occur, you don't have any system. So what we would like to see is a resilient health system. We'd like to see universality of vaccination. That is possible, by the way, by 2030. We won't get all other health things done, but that's an SDG goal we could get to. And with that is a system, surveillance, a health worker, a supply chain. You can then build on that to build out the comprehensive system. And we believe that that is what we need to have. But I want to just reemphasize one thing, which is it is evolutionarily certain we will continue to have outbreaks. So we need a system that is able to deal with this. And you play an incredibly important role in this to keep the world aware of that and to make sure that the appropriate investments are done. I mean, we do this on the military side. There are militaries in every country, even pacifist countries, and people do war games, and they're always prepared. They work together in trying to, help, fight foes. But for diseases, we haven't done that in the same way, and we need to take this opportunity and make sure we do that going forward.